Hello my dear students, I am Dr. Vaishali Bharambe, Professor Anatomy. And today we are studying the hand of benediction, a medial nerve injury. What does this image show us? This is called as the gesture of benediction. Please note the position of his hand. It's a sign of benediction, a voluntary hand gesture used by priests to convey blessings. Note, it is deliberate. You are seeing now a position of the hand which is quite similar, which is called as the hand of benediction. This, however, is a pathological condition. Let's understand this. So, the hand of benediction is seen in medial nerve injury. It is seen when the patient with a medial nerve injury attempts to make a fist. How does a normal hand make a fist? When a normal hand makes a fist, all the fingers flex together. However, in a medial nerve injury, something very interesting happens. When the patient attempts to flex the fingers, the index and the middle finger fail to flex properly, while the ring and the little fingers flex normally. Why does this happen? What muscles flex the fingers? To make a fist, finger flexion takes place in two stages. Flexor digitorum superficialis flexes all four fingers. This note is supplied by medial nerve. Flexor digitorum profundus flexes the four fingers. This, you must note, is having a dual nerve supply. The muscles to the index and the middle finger, that is the lateral two fingers, is supplied by medial nerve, and the muscles to ring and the little finger, medial two fingers, is supplied by the ulnar nerve. Look at your hand. See that the ring and the little finger are supplied by the ulnar nerve. See that the index and the middle fingers are supplied by the medial nerve. Revise that. What happens in high medial nerve injury? In high medial nerve injury, flexor digitorum superficialis is paralyzed for all fingers. Lateral half of flexor digitorum profundus, that means the muscles to index and middle finger, is also paralyzed. Why? Because both are supplied by medial nerve. However, medial half of flexor digitorum profundus, that means the ring and the little finger, remain normal because they are supplied by the ulnar nerve. They can function. Let's take a look at this patient. Ask your patient to make a fist. In the index and middle finger, the flexor digitorum superficialis and flexor digitorum profundus are both paralyzed because the medial nerve is injured. Therefore, they remain extended. In the ring and the little finger, flexor digitorum superficialis is paralyzed because it is supplied by medial nerve. But the flexor digitorum profundus continues to function because it is supplied by the ulnar nerve. On the basis of this, the fingers flex into the palm. This posture of the hand resembles a hand raised in blessing, hence it's called as hand of benediction. Here you are looking at a medial nerve. I want you to bring your attention to the forearm where the medial nerve is supplying flexor digitorum superficialis and lateral two tendons of flexor digitorum profundus. So now you must imagine, where should the medial nerve be damaged for both these muscles to be paralyzed? You can see that this damage must be quite high up. Thus you must note that hand of benediction occurs only when the injury to the medial nerve is quite high up, almost above the elbow joint, somewhere here. So what are the conditions that can produce hand of benediction? Supracondylar fracture of humerus, injury to the medial nerve at the elbow, penetrating or compressive injuries in the proximal forearm. Just remember, the hand of benediction is not seen at rest, so the patient cannot come with a hand of benediction. When you ask the patient to make a fist, then only the condition becomes obvious. So that was about the hand of benediction, a high medial nerve injury. Perhaps the hand of benediction is anatomy's very subtle way of letting a little divinity sneak into clinical science. Thank you, students. I hope you enjoyed this lecture, and if you do, then do please like, share and subscribe to my channel and hit that bell icon. Do visit my website vbanatomy.com for detailed lectures, for notes, for surgical anatomy videos, histology diagrams, MCQs and much more. Link is in the description section. Thank you, students. I'll see you in my next lecture. Bye.